Hi, I'm Cameron. I'm a student physical therapist. I'm going to be going through active range of motion, passive range of motion, and manual muscle tests for the hip. I have my patient right here. Do I have your permission to start? Awesome. We're going to be going through hip flexion first. Patient's going to be on her back, supine. I'm going to show her the action she's going to be going through first. Knees to her chest. Perfect. If I had a goniometer, my axis would be at the greater trochanter. My stationary arm would be going up through the midline of the pelvis, and my moving arm would be going down the femur to the lateral epicondyle. When my patient is ready, I'm going to have her go through the same motion. Perfect. And I would take that reading, and she can go ahead and relax. And then I'm going to go through passive range of motion for her. I'm going to be doing the motion for her, and I should be getting a deeper range of motion. Good, and I would take that reading as well. She can relax. The end field for hip flexion is going to be a firm end field, and the normal range of motion is going to be 0 to 120. Next, we're going to go through the manual muscle test for hip flexion. So I'm going to have her stabilize herself with her hands by her side. I'm going to stabilize at the hip. I'm going to have her raise her knee to her chest. Good, she can hold there. That's at least a 3. She can go back down and relax. I'm going to do it one more time, but I'm going to apply pressure this time. I want her to resist me. Up. Hold, 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 and go ahead and relax. She was able to resist my force, and I would grade it a 5. I'm going to be going through hip extension next. I have my patient on her stomach in prone position. I'm going to go through the motion with her first. She's going to be going up, back down. Again, with a goniometer, if I had one, the landmarks would be the same. It would be at the axis would be at the greater trochanter. My stationary arm would be going up through the midline of the pelvis, and the moving arm would be going down the femur to the lateral epicondyle. When my patient is ready, I'm going to have her go through the same motion for active range of motion. Perfect, and I would take that measurement there, and she can go ahead and relax. And I would do the same thing for passive range of motion, but I'm going to do the motion for her. Good. Able to get a little bit more range with passive range of motion, and she can relax. The end feel for hip extension is going to be a firm end feel, and the normal range of motion is going to be 0 to 20. Now we're going to do the manual muscle test for hip extension. So I'm going to go up again in the same motion. I'm going to stabilize the hip so there's no compensation of any other muscles. Good, she can hold there. It's at least a 3, she can go back and relax. I'm going to have her do it one more time. This time I'm going to apply pressure. I'm going to have her resist me. Hold, 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 hold. Go back down. She was able to hold my resistance for a little bit, but it ultimately broke, so I'm going to grade that a 4. Next thing we're going to do, we're going to go hip abduction. I'm going to have my patient back on her back in a supine position. So I'm going to have her motion is going to be going out away from the midline, away from her other leg. So it's going to be going out like this. Perfect. And if I had my goniometer, my axis would be at the ASIS, the anterior posterior iliac spine. I would find the iliac crest and walk it down to the ASIS. And then my stationary arm would be going across to the other ASIS, and my moving arm would be going down the femur to the patella. So when my patient is ready, I'm going to have her go through the same motion we did first. Good, move away from her other leg. Good, gonna relax. Now I would take my measurement here and go right back down. Next, I would do it passively. I would do the motion for her. Stabilize at the hip. Going out, trying to get a little bit more range. Perfect, and I'll take that measurement as well. The end feel for abduction of the hip is going to be a firm end feel, and the normal range is going to be 0 to 45. Next, I'm going to do the MMT for abduction. So I'm going to show her the motion I want her at. I'm going to stack her hips, stabilize at the hip. Good, right around here. Can you hold right there? Perfect. Right back down. Now we'll do it one more time. I'm going to apply force this time. I want you to resist me. Hold, 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 hold. Go ahead and relax. Because she was able to resist my force, so I'm going to assess that at 5. Now we're going to do a deduction. I'm going to move the opposite leg out of the way. And the motion is going to be towards the midline, towards her opposite leg. So opposite what we just did. So it's going to go in this way. Perfect. And then the landmarks for the goniometer is going to be the same as a deduction. So it's going to be, find the iliac crest, going to walk it down to the ASIS. My stationary arm is going to be going across to the opposite ASIS. My moving arm is going to go down the femur to the patella. So my patient's ready. I'm going to have her go through that same motion, going towards her opposite leg. Perfect. This is going to be for active range of motion. Now I would take that measurement, and then she can relax. Good. And I would do the same thing for passive range of motion. I'm going to do the motion for her. Good. And we're able to get a little bit more range with passive range of motion. She can go ahead and relax again. So the end feel for a deduction is going to be a firm end feel, and the normal range of motion for a deduction is 0 to 20. So I'm going to have my patient side lying again. We're going to do the MMT for a deduction. I'm going to stack her hips one more time, stabilize at the hip. I'm going to hold her upper leg, and I'm going to have her raise her bottom leg off the ground. Good. She can go ahead and relax. Okay, one more time. I'm going to add force. I want you to resist me. Hold, 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 hold. Go ahead and relax. She's able to resist my force. I'm going to grade that a 5. Next, we're going to do external rotation of the hip. So my patient's going to be on her stomach again, and the motion is going to be going in like this. Perfect. Good. I'm going to have her raise her knee again one more time. So with my goniometer, my axis is going to be at the patella. My stationary arm is going to be up the tibia shaft, perpendicular with the ground, and my moving arm is going to go with the motion of the leg. So my stationary arm is going to stay up, and my moving arm is going to go with the leg, like that. So when she's ready, I'm going to have her go through the same motion. Good, and I would take that measurement. She can go ahead and relax. And with passive range of motion, I'll do the motion for her. One more time, up. Good. And we should be able to get a little bit more range. Perfect. So for the end feel, for external rotation, it's going to be a firm end feel, and our normal range of motion is going to be 0 to 45. Now we're going to go through the internal rotation of the hip. So I'm going to do almost the same. We're going to go opposite direction this time. So I'm going to go in this direction here. Perfect. My landmarks are going to be the same. So my axis is going to be at the patella again. Stationary arm is going to be going perpendicular to the ground, going up, and my moving arm is going to go with the movement of the leg going out. When my patient's ready, I'm going to have her go in that same motion for me. Her foot's going to go away from her other leg. Perfect. And I would take that measurement there. That's by herself, and she can go in and relax. And I would do the same. Next, I'm going to do the passive, so I'm going to do the motion for her. Up, she's going to hold, out with her. Perfect. Right back down. So for the end feel of internal rotation is going to be a firm end feel, and the normal range of motion is going to be 0 to 45. Now we're going to do the MMT for external rotation of the hip. So I'm going to go through the same motion like this. And I'm going to have her do it by herself. You hold there. Now I'm going to apply pressure to the outside of the knee. at the medial malleolus. I don't have her resist me. Hold, 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 hold. Going to relax. She's able to resist my force. I'm going to grade that a 5. Now we're going to do the opposite. We're going to do the MMT for internal rotation of the hip. I'm going to have her go out like this. Perfect. I'm going to have her hold. Good. Right back down. Next time I'll have her go out one more time. I'm going to stabilize at the inside of the hip, the knee, and I'm going to apply pressure at the lateral malleolus. Hold, 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 hold. Go and relax. Again, she was able to resist the force I was applying, so I'm going to grade that a 5.